Hi, I'm Sarah Henshaw. Today I'm going to be talking about globalisation and how it impacts on healthcare throughout the human life cycle. I'll be talking about some advancing healthcare technologies and also giving examples of some key healthcare requirements throughout the human life. I'll also be introducing the concept of global inequality in healthcare. Globalisation, as defined by Giddens, is the intensification of worldwide social relations which link distant localities in such a way that local happenings are shaped by events occurring many miles away and vice versa. This definition emphasises humanity and society, and that's why I think it's relevant for this topic. Advancing healthcare technology. Body-worn health sensors have the ability to provide personal health monitoring with an emphasis on prevention of lifestyle diseases such as heart disease, diabetes and some cancers. This technology is set to become increasingly valuable and even being inserted under the skin as opposed to the current outer-worn devices that we have now. Smartphone technology. The importance of this is through the applications for health and fitness and medical capabilities that allow real-time links between patient and healthcare practitioner. Additionally, smartphone technology can really benefit remote areas and can contribute through data sharing with collection of this information. Better co-founder Jeffrey Clapp suggests that with smartphones increasing health accessibility to remote locations and as the portability of data sharing increases, the pace of innovation in digital health will grow exponentially. Medical tourism. Traditionally seen as a cosmetic surgery option, medical tourism provides patients with the opportunity to compare and select online procedures that may either be too costly or have long wait periods in their home country. Additionally, the economies of these countries offering such services can benefit through this export income, which can then go back into their public health systems and also help to retain medical professionals within their own countries. Personalised DNA analysis in the form of genome sequencing could be the way of the future, with diseases being predicted before they even occur and then treatment plans being tailored based on DNA. Whilst these procedures are expensive and not really available at the moment, no doubt in the future we'll see increased accessibility to such services. The future of nutrition in terms of insects, which provide a nutritional alternative to meat, particularly for those countries that do not have either the resources to grow a great deal of their own food or sufficient food. And this could also provide an export opportunity for them as Western cultures catch on and realise the health benefits of insects, which many Asian countries have been enjoying for years and years already. I'd like to now go through a few examples of some healthcare requirements throughout the human life cycle. These are based on the presumption of a first world environment, and we've been able to benefit in general from globalisation in regard to pharmaceutical drugs, shared global technology and research and information, that sort of thing. Additionally, there is an emphasis here on prevention, which is going to be the way of the future. The prenatal birth area, globalisation has allowed the early screening for birth defects to occur, and this has been made possible through technology such as ultrasound and blood analysis. In the early childhood age range, adequate nutrition and immunisation are both very important. In terms of nutrition, we've access now to a range of fruits, vegetables, grains and proteins, more so than ever before, as well as supplements if required. In terms of vaccination, we've benefited from research and development of vaccines and access to pharmaceutical drugs that have been developed worldwide. The teenager, adolescent age, sexual health is really important here, and through globalisation we've been able to benefit from, for example, sexually transmitted disease or STD products such as condoms, which are also really important in third world countries where these diseases are prevalent. We've also been able to benefit from advanced screening technology and blood analysis, and through the treatment through pharmaceutical drugs. In the early adult 20 to 50 type age, there's a real focus on general health and well-being, physical activity, and these can be advanced through the body-worn health sensors, and through smartphone apps. We see a huge range of health and fitness apps here. In the older adult 50 to 75 category, disease screening and treatment becomes increasingly important. For example, breast cancer, bowel cancer, prostate cancer. And we've been able to benefit from globalisation through the technology with ultrasound and blood analysis capability there. Additionally, in the elderly 75 age group, general health and mobility again is increasingly important, and through education in terms of prevention, we've been able to, or we will see, I think, an increase in health and mobility at that age. Additionally, globalisation has given us access to the smartphone technology that we talked about earlier on, as well as the DNA analysis, which may become more prevalent in the future. The inequality in healthcare, it's difficult to understand how such polarisation exists between first and third world countries. And millions of people annually are dying from poverty-related or neglected diseases such as HIV, malaria and tuberculosis, things that are largely preventable with adequate treatment or preventative treatment. In terms of foreign aid, there needs to be a continuation of the research and development, innovation for life and not for making money, and access to technology that can improve lives of people in such countries. In conclusion, the evolution of healthcare is continually changing, and we see the impact of globalisation through all areas of healthcare, including education, monitoring, treatment, research and development, innovation, and there is and will continue to be a real focus on preventative care throughout the world in years to come. Thanks for watching. Goodbye.